we have is we have these needles, and what I like to do is I like to dull the needles. And the reason for this is if we dull the needle prior to doing injection, they're less likely to tear through the tissue, and that will minimize the amount of bruising you're going to see. So we just lightly dull the needle, then we wipe it off so we don't have any small particles of metal that'll get into the tissue. So now, what we want to do is they're pre-mixed, and you can see if you look closely, it's just, you can't see any discrete particles in there. See how it's just a cloudy mix? And that's how we want it to look. We leave the solution in, we hydrate the solution the night before, so it will turn into more of this clear, or this opaque look. So it really helps to get all of the Sculptra hydrated. Okay, so now what we want to do is we want to just soften this here just by lifting this out over here. So what we're going to do is put the needle in and then go all the way to the end, and then sometimes it'll clog, and so what we have to do is we have to try to clear that clog. You can see we're using a fanning pattern to deposit the product. Okay, great, thank you. So now here I want to lift it up back here as well. This whole area we're going to try to revolumize. And with this product, one of the things we like to do after we inject it is we like to have the patient massage the area for 5 minutes, 5 times a day for 5 days. And do any of you know why we do that? Jose, tell us why we do that.
To prevent the sculptoma?
Yes, so to prevent those nodules from occurring. Now what I'm doing is I'm trying to get all the way out to those preauricular wrinkles here. And then we just want to make sure we get the transition from the jaw to the neck to be softer. Great.
Is the solution like really thin, or is it?
It's like water. It's really just a water, yeah.
It's literally like Kool-Aid.
There's
like,
lidocaine in it, so it makes it very, it's nothing like Restylane or any of those other ones that I've heard a lot more.
And again, we're lifting out the cheek, trying to soften that transition between the jaw and the neck. We put a little bit along here. And you can see even though the needle is dulled a little bit, it slides nicely into the tissue. And our patient that we have here today, you guys, we're trying to record. So the patient that we have here today is kind of a squeamish patient too. He's not the easiest patient to work with. And so you can see he's pretty comfortable, which is unusual, you know, because most of the time he's kind of a jumpy guy. So Lee, how badly would you say it's hurting you?
Go 3. Ouch.
Okay.
Maybe 4 now.
Okay, there we go. And that's all there is to it. Now what we'll do is we'll do the aggressive massage. Now some people think a massage is like this. It's not. We take and we just really rub that in aggressively. And we'll have our medical assistants rub that in. And you can see it just sort of fills out the sides and just makes it look more youthful. Can you guys see that? Now this is the initial effect is from the water, but the final result is from the stimulation of the collagen. So it's going to look really nice, and it just lifts that up, because before he started his treatments, this is probably his 3rd treatment, he really had some significant jowling going on here, and it's really, you know, made his face look young and fresh again.
3 months to see the results of this?
About 3 months before we'll see the results. Any questions? No.
How much did you just use over?
We just did 1 vial.
Just one?
1 vial, yeah.
What's the pain tolerance comparable to like a Restylane or a
It's really low. That's why I like it so much. Restylane, it just seems like every puncture hurts a lot. With the lidocaine in this, it just hits really fast. And even on the initial, maybe it's because of the threading technique. Instead of straight in to the, what's that layer that sometimes you go down to?
Now, the other thing is that with this, I like to use it on the lateral face where there's not as many nerve fibers. Whereas when you're using the Restylane and Perlane, I like the central face. And so these are areas where there are a lot more nerves, like the lips are very sensitive, the nose is very sensitive, the underneath the eyes is pretty sensitive. So there isn't as much, there aren't as many nerves that will make it feel as painful.
Thank you.
Okay, thank you guys.